Hello, everyone. I'm sure many of you are already aware about my letter that I have recommended and asked the governor to actually ban the vaping products, the e-cigarette products in our state for some time, at least 4 months. And I'll want to try and explain because it's important for people to understand where I come from. First, I'm a lung doctor, so I see patients with lung illnesses and respiratory problems. Now, what has happened in the recent past, more so in the last many months, is there has been a very significant increase in the number of cases of people who are having breathing problems related to vaping. Now, everybody recognizes, whether you are in the sales industry of vaping products or others, that we have an epidemic of people, young boys more so than the girls, who are actually smoking and usually vaping. This vaping is associated with now new illnesses that we have identified. There is still a lot of research and questions that are being asked. Yesterday, a big publication came out which looked at a series of patients that have been identified, some that have passed away and some that are alive. This is an acute onset, which is a relatively sudden onset illness that people are developing, where that individual would get infiltrates in their lungs. They have pneumonia-like features in the lungs, they have fevers, they have respiratory problems, their oxygen levels drop. And they also have GI symptoms like gastrointestinal symptoms, nausea, vomiting, diarrhea symptoms as well. And these individuals have what we are now recognizing a vaping-associated lung injury, which is a significant illness which has caused, by this time when I'm recording this, about 16 people have died. Over 800 people are actually with severe significant illness across the country, including many in the state of Connecticut as well. I just spoke with one of my friends who's taking care of a patient who is sick with this as we speak. Now, this illness, as we have looked at some of those cases, can be divided into 2 or 3 broad categories. One of them is it's almost like an allergic reaction to something in the vaping chemicals that has been there. So that allergic reaction has high eosinophil count. Again, I'm using some words for my medical audience as well, that there's eosinophilic response, almost like a hypersensitivity pneumonitis. And some of the other set of illness that we have identified is lipoid material, lipoid pneumonia-like features, which is like a fat component that is in the vaping products, is causing that to cause reaction in the lungs. And of course, if somebody already has obstructive airway disease, asthma, and so on, they would have exacerbations. But those are separate illnesses compared to this acute illness that we are seeing in these patients. The causations is still not clear, but people are looking at various possibilities. The challenge is that these cartridges are coming in different forms by different entities, which is resulting in possible things which are not pure, but also things that are meant to be there for preservatives, glycols, and some of these things that are there which are fat soluble cause that inhalation products to be taken in the lungs and they stay there. This is actually causing death in people. Individuals are dying. And if you look at the number of people who have been impacted, 2/3 of them are young individuals who are between the age of 18 to 30. And that actually goes along with the vaping community, the people who are vaping. That results in truly a severe reaction, and many of these individuals would have, in the absence of appropriate level of care, have a high risk of having severe compromise for the rest of their lives. We have to have responsibility at this time. I want to urge anyone who's in different age groups, all age groups, to please don't vape at this time. It's important. We need to, as a society, come up with a plan, what needs to be done, what is safe, how do you regulate this. And I understand that there is a whole industry that is trying to make money from this whole opportunity, but lives will always be more important than people making some extra money or any money right now. And then what I would suggest is that people stop vaping. The policymakers make sure that we do what we can, whether it's administrative level or legislative level. We need to have a plan to stop vaping at this time, till we have a better understanding, till we understand what are the products that are causing trouble. I hope you would consider this. Please help your loved ones who are vaping to stop them as well, because time is of the essence and their lives are very important. Thank you.